So what I'd like to do today is to show you a piece of technology that I think will amaze you. Now, I know we all have our gadgets that we love, the latest tablets and the smartphones, and we want the latest and the greatest. Well, I think I have something here that you may not have. This device saves lives, and right now, millions of people are using it to lead healthier lives. Do you want to see what it is? So there we go. So for those of you in the back who can't see this amazing device, here are a couple of other examples. These are actual phones that are being used every day. Can you see the branding, Nokai? There are other fake brands as well, like Nokia and Samsung. So tell me, how many of you think that you can write a text message from the white phone? So let me tell you why these phones are so special. We can get really excited about new technologies and how they'll transform our lives, and they really will. And this technological progress is unstoppable. But what I want to talk about today is not the technology that is coming on stream, but what we have right now. And when I say we, I don't mean those of us in this room or those who are watching this online. I mean those that lack access to information. Life-saving information. Those that don't have access to the internet or to TV, but for those who have phones, just like these. So this is Muni, and Muni is about to do something potentially very dangerous. She's about to have a baby. And this is dangerous because she lives in Bihar, which is one of the poorest states in India. And Muni's chances of death due to pregnancy or childbirth are 14 times greater than for a woman giving birth here in New York City. The statistics globally are pretty staggering. So every 5 minutes, 3 women die from complications in pregnancy or childbirth. And if we look at the number of women here, the vast majority of them are Indian. And about 150 Indian women are dying every single day in childbirth or in pregnancy-related complications. I lived in India for 7 years, and I saw firsthand the risks that pregnant women and newborn children face, and they're so preventable. If we could encourage families to give birth in a health facility or to space their pregnancies so that there's a healthy interval, then these are things that can drastically reduce risk. So what can we do to support women like Muni to make these healthy decisions? So one of the things we could do is empower community health workers to do more with what they have. So community health workers provide vital outreach to women like Muni and others, and they go door to door. And they not only convey information, but they persuade families to make healthier choices. But these community health workers, and here's an example of one right here, often struggle to get their message across. In Bihar, like in similar settings, they are women, they're educated to about high school level, and they often are inadequately trained and equipped, and they don't always get the respect from the community that they deserve. So how can we support them? Well, what about giving them lots of flip charts and print materials that they can carry with them to support their day jobs? We could replace something like this with this. Not so great, huh? I mean, she would have to carry a really big box with lots of flip charts in order to cover all of the information that she needs to cover with all the women in her catchment area. So this isn't going to be a solution. So we asked community health workers what would make a difference. And we found out a lot of interesting stuff in the process. For example, some more data. We found out that in Bihar, 18% of women of reproductive age watch TV, and 11% listen to the radio. So we knew then that traditional media sources were not going to be the most ideal way to reach women alone. Then we found out that 82% of women have access to mobile phones. Again, mobile phones like this one. most encouragingly, we also found out that all community health workers either own or have access to a mobile phone. A phone, again, very much like this one. So let me tell you about the organization that I work for and what we're doing to help women like Muni. So I work for BBC Media Action, which is the BBC's international organization working on development issues using media and communication to save lives. Now, what we're doing is we are harnessing the power of very basic mobile handsets to reduce maternal and child mortality in rural India. And this is how we're doing it. So we needed to understand how community health workers use their phones if we're going to have a mobile solution. What we learned is that only 9% of community health workers had ever sent a text message. The vast majority of them didn't know how to open a text message or to locate their mobile, their address book on their mobile phones. And so while they have mobile phones, they're using them to make and receive phone calls. That's about it. So we knew that our solution had to be quite simple and get around these challenges of technical literacy. So what we did is we created this, and it's in two components. We've got a deck of cards, and there are 40 cards here. And each card has an illustration on it. These 40 cards cover all of the key messages that a community health worker needs to convey to a pregnant woman all throughout her pregnancy and into early child care. And so if you are the family and I'm the community health worker, you are seeing the illustration. And this is great for those families who have women who are illiterate. And so this one happens to be about hand washing. And as the community health worker, I also have information on the back that is going to guide me on how to conduct this conversation. Now here's where the innovation comes in. On the bottom of each and every card, there is a unique 7-digit number. This is called a mobile short code. And what this does is you just dial it from your mobile phone and you get a message. And that message is from a doctor. What we know is that if a doctor says the same thing that a community health worker says, it immediately adds credibility to what she's saying, and it elevates her status and respect in the community. So this is what happens. So either the community health worker will put her phone on speaker and then they can both listen, or she just hands the phone to the woman to listen. So what does she hear? She hears the voice of a character we created called Dr. Anita. So Dr. Anita is there all the way through the pregnancy and into early child care, helping her along the way. And here's where the creativity of the BBC comes in. So we don't just have Dr. Anita talk at the women. Creative techniques are used to make educational content exciting, interesting, and engaging. So Dr. Anita is talking in a reassuring voice, and she's using culturally appropriate words that are really going to resonate with the women. And again, we know that the community health worker, when she enters the village, now she's more credible and she's got along with her the doctor in her pocket. So don't take my word for it. Here's a quote from a community health worker, and she says, "Ever since I started using the job aid, the community's respect for me and what I do has grown. When I now walk into the village, people call me Dr. Didi and ask me to give them information." So that's just one of many quotes. Now, really importantly, I want to underscore, this is just a phone call. So there's no complex laptop distribution schemes or smartphones that need to be sent out and repaired and lost when they're lost and stolen. So there are no new skills either. And what this means is that we can go to scale immediately. So we are already on course to involve all 200,000 community health workers in Bihar in using this service. And because it's just a phone call, we had to negotiate with all of the mobile network operators in India, all the 6 major ones. And we negotiated discounts that are among some of the lowest call charges in the world. And this is of no cost to the health worker or the family. Seeing the public health benefit, the government of Bihar has agreed to pay for all of the call costs. So what we're doing here, and another benefit of mobile phones, is that it allows us to track, us and the government of India, to track which calls are being made, on what topics, by which community health workers, when and where. And so this is providing valuable public health information to the government. And we're not aware of any other tracking system that does this anywhere in the world at this scale with very simple mobile handsets. Over the next 4 years, we are going to track what kind of impact this is actually having on health behaviors. So far, we've heard that there's been a spike in some areas of women visiting health facilities. And pregnant women are telling us already that their health worker and Dr. Anita have convinced her to use these free services that the government has. These are just a couple of anecdotal examples of how we think this is going. So what next? We are talking to the government of India of taking this to other states, and we believe that this could go anywhere where community health workers need support and where pregnant women need information. So that's it, a simple technology, a simple phone call. What I want to conclude with is to say that we actually should be really excited about new technologies, that they're going to transform health systems completely. So new smartphones, for example, are going to be able to digitalize health records. There are even smartphones that can diagnose conditions right then and there. You can track medical supplies. I mean, these are really going to transform healthcare in the developing world. And we should be excited about them and look forward to them becoming ubiquitous. But there's also beauty in simplicity and in the here and now. And while we wait for these new technologies, these smarter technologies to take hold, if we use what people have in their hands, we can start saving lives now. Thank you.